More than 2/3 of all deaths in the world are caused by non-communicable diseases, or NCDs. Nearly 40 million people die each year from causes such as cancer, diabetes, cardiovascular disease, and chronic lung diseases, and NCDs impact people of all ages. Low and middle-income countries account for 3/4 of deaths from NCDs, and each year 100 million people are forced into poverty as a result of these diseases. While the diseases themselves are not communicable, their burden often is, rippling out through families and communities, leaving people uncertain about their future. How will I get to my next appointment? What will the next test reveal? Can I afford a consistent supply of healthy food to prevent complications? Can I afford my next treatment and still provide for my family? Meet Shammah, one of 14 million people living with diabetes in Africa. When he was 2 years old, Shammah became ill. Without a proper diagnosis, he fell into a diabetic coma. Now an active 12-year-old, he controls his diabetes by monitoring his glucose level and by eating a healthy diet. For families like Shammah's, where a child has type 1 diabetes, parents have a lot to manage, ensuring ongoing care, access to healthy foods, refrigeration for insulin, and testing equipment. At times, these parents may be forced to make impossible choices between buying insulin, paying school fees, or putting food on the table. These are also challenges that families confront when the primary income earner suffers from an NCD. After Edward had a stroke, he lost his well-paying job as a teacher and endured a long and expensive rehabilitation. Hypertension is the leading cause of stroke and heart attack, and rates of hypertension are increasing rapidly in low and middle-income countries. Even though Edward recovered, it is difficult for him to get to his appointments because he now has limited mobility on one side of his body, making the risky motorcycle ride to the clinic even more of a barrier to care. Edward's family has been instrumental in helping to manage his condition, but they still face a major financial burden to pay for his care and also to make ends meet for the household. For older people, NCDs are particularly devastating, accounting for 90% of their disease burden. 60-year-old Rehema receives treatment for hypertension and diabetes, but too often, the nearby government pharmacy is out of the drug she needs, so she must travel by taxi or bus to a military hospital further away in order to purchase the medications. Added transport and medication costs put a strain on Rehema's modest budget. Whether you're 16 or 76 years old, everyone has the right to healthcare, and ensuring access to medicines and products for those living with NCDs is a crucial step on the path to universal health coverage. Investing in access to treatment and care for people with NCDs is an investment in individuals and their communities. By making that investment, we can ensure that people like Shammah, Edward, and Rehema have access to the care they need so that they can achieve their full potential. We can't wait to see what's next for them.